Live from KTTC, your weather authority, this is KTTC News at 6.
Thanks for joining us tonight. Some good news today as we are on the downswing of the latest COVID-19 surge, and children under 12 may be able to get vaccinated as soon as November.
That's the good news, but Mayo Clinic is still recommending against indoor Halloween celebrations, at least this year. Our Carly Petrus is live with more on what Mayo Clinic is suggesting to keep kids and adults safe. And what did you find out, Carly?
Well, Tom and Caitlin, Mayo Clinic says there are plenty of safe events to enjoy this fall, including the one right behind me. This is Sandywood Halloween light display, and it is a drive-by that is free. It is open daily from dusk until midnight for everyone to enjoy. The leaves are turning, the pumpkin patches are open, and fall fun is here. But the pandemic still looms, and some are worried about transmission. According to Mayo Clinic, anywhere indoors with a crowd is considered high risk.
For example, having an indoor Halloween party, especially where you will have lots of children under 12 years of age, for example, who will not be vaccinated.
This time last year, though, the guidance around Halloween festivities were much stricter.
We have learned a lot about this infection, a lot about this virus. We know more about how it impacts children's health, and we know more about how it's spread. And most importantly, we know that there are things that we can do to reduce the risk of exposure and transmission to the virus.
If you do decide to have an indoor gathering to celebrate the holiday, Mayo Clinic says there are things you can do to reduce the risk of getting COVID-19.
Limiting the number of people at any indoor gathering, limiting it to people who are fully vaccinated. That at this point would limit you to people over 12 years of age. Paying attention to ventilation, so opening doors and windows, allowing as much air circulation to happen as possible, and ensuring anyone, regardless of their vaccination status, is wearing a mask.
Activities that could be considered lower risk are those that are outdoors.
Going to a pumpkin patch, carving a pumpkin outdoors, painting or decorating pumpkins outdoors, decorating your yard. Now, we know the virus does not spread well outdoors.
Now, the Mayo Clinic says the FDA is meeting October 26 to discuss the data that Pfizer has presented to them regarding administering the vaccine to children ages 5 to 11. When it comes to children under the age of 5, clinical trials are still being done, and that data will not be presented until later this year. Now, tune in at 10 to hear more about this fun light display behind me. And I'm Carly Petrus, live in Rochester, KTTC News.
A lot of fun out there, Carly. Thank you.